Morning, everyone. My name is Mike Caligiuri. I'm the director of the Cancer Center at Ohio State University, CEO of the James Cancer Hospital. And I'd like to welcome all of you and thank you for being here. So the Institute of Medicine, now the National Academy of Medicine, established the National Cancer Policy Forum to serve as a focal point and trusted venue for the engagement of national leaders from multiple sectors working cooperatively to address high-priority policy issues in the nation's effort to combat cancer. The Academy draws upon our unique independent status and expertise to steward sustained discussion and collaboration among national experts and health stakeholders on issues relevant to the goals of preventing and treating cancer. Participants represent clinicians, patients, researchers, professional and advocacy organizations, pharmaceutical manufacturers, and policymakers. The objectives of the forum are first to identify emerging high-priority policy issues in science, clinical medicine, and public health that are relevant to the goals of preventing and treating cancer, and second, to examine those issues through convening activities that promote discussion about potential opportunities for action. So in this regard, I'm delighted to introduce Drs. Shih and Ralph Weichselbaum, who are the Planning Committee co-chairs for the workshop that's entitled The Appropriate Use of Advanced Technologies for Radiation Therapy and Surgery in Oncology. Tina?
Thank you very much for coming today. My name is Tina Shih, and okay, how do I move? Okay. I'm a health economist at MD Anderson Cancer Center, also a National Cancer Policy Forum member. So there's been, the value in cancer care has been a long-term interest for National Cancer Policy Forum for several reasons. One is because of the exceedingly high cost of new cancer treatments that leads to a concern of unsustainable increase in the cost of cancer care, and also a concern about substantial financial burden to patients and their family member. And all those concerns were getting aggravated because we're facing an aging society, with age being one of the prominent risk factors for cancer. New technology has always taken the center stage at a discussion of value in cancer care because they're almost always more expensive than existing technology. They may or may not lead to better health outcomes. And a lot of time you see a lot of non-clinical factors have a larger influence on the utilization of new technology compared with the existing technology. For example, in the health economic literature, you would hear terms like provider-induced demand. So those are the cases like physician ownership of MRI or IMRT that can cause them to sway the treatment pattern one way or the other. On the flip side of the coin, you also have consumer-induced supply. So those are the cases that educated consumer coming to physician's office demand to be treated with the newest technology possible. So those are all playing into the utilization pattern we're seeing today in the use of new technology. And this kind of discussion for value in new technology is to try to find the best treatments that are both affordable to cancer patients and to the society through discussion on how to appropriately use advanced technology. So in the past few years, there have been several workshops around the value issues hosted by the National Cancer Policy Forum. Started from 2009, there was a workshop on assessing and improving value of cancer care. 2012, we have another one looking at delivery affordable cancer care in 21st century. A lot of the discussion from that particular workshop has feed into the IOM report on quality of cancer care, and I think a lot of people in the room are familiar with this report. It was released in 2013. Last year, we did another workshop looking at the value in the cancer drugs. So you might be asking then, why do we need another workshop looking at devices and especially radiation treatment and surgery? There are 4 reasons for today's workshop. One is that there are important differences between drug and devices. So those are just the list that I compiled. The list can be even longer than what you've seen here. So the most The one that's most talked about is the approval process between drugs and devices, when clinical trial being a requirement for drug approval, but not necessarily for device approval. The mechanism for post-marketing surveillance might also be different between drugs and devices. Another difference is in terms of how do we set the price for drug versus devices. For drug, usually the drug price was set by the manufacturers. For devices, you're actually talking about two prices. One is the price for the device itself, so how much they sell, for example, a robotic machine to a provider. The other one is the price for the price for the procedure that was performed using the new devices. And for the second kind of price, it's usually set by the payers. Another important difference is the life cycle between drugs and devices. If you look at drugs, usually they started from patent protection, then there would be a pretty steep price reduction after generic entry. We don't see that happen in devices. For devices, you have a huge depreciation of the device over time, and then you replace with a new one. But you really never enjoy the advantage from generic entry in medical devices. Off-label use is another difference between drug and devices. It's relatively easy to differentiate between on and off-label use in drugs. For devices, in a way, many things are used off-label, but then the line is just very blurred between indicated and off-label use. For devices, there are also a large capital investment components that can create incentive for providers. If they invest $10 million on a machine, they're going to try to figure out a way to recapture the investments. In terms of payment innovation, there's been more discussion on the oncology drug side. For example, you heard discussion about bundle payment, tier formulary, or pathway. Relatively few discussion or few attention has been devoted to medical devices. And hoping after today's workshop, there will be, we will find more solutions on how to deal with the payment issue. The second reason for today's workshop is the proliferation of medical devices. Taking robotic surgery, for example, in 1999, there are 2 machines in the US. 2003, those are new machines being installed. This is 2007, 2008. By 2015, there's over 2,200 machines in the US hospital. So that's just how fast this new technology has happened in the US. The third reason for today's workshop is usually new technology has a really fast uptake in oncology. These are 2 examples. One is for minimally invasive radical prostatectomy. The other one is for breast brachytherapy. And all you see is like in 4 to 5 years, you see a huge uptake of new technology. And we see that happen in a lot of new technology already. And of course, there's financial consequences for the pattern that you've seen so far. So one study look at robotic surgery has concluded that use of robotic surgery increased the cost of surgery by about 13%. Another study looking at radiation oncology compared to all the other specialties in Medicare, they found that radiation oncology has the highest access growth among all the specialties in Medicare. So those are reasons leading to today's workshop. And for today's workshop, we separate into 3 sessions. The first session is going to be talking about the science and the comparative effectiveness evidence. The second session would happen in the afternoon. We'll be talking about from the discovery side to what we're seeing in the marketplace. So you have, you would learn from the FDA speaker on the approval process, CMS speaker about how they set the reimbursement price, and also the actual utilization pattern and what are the factors influencing those patterns. The last session would happen tomorrow. Speakers would take what we learned from today's session and discuss how do we assess value and define optimal use for radiation therapy and surgery in oncology. So this is my planning committee members. I want to give a big thank you to my planning committee member and also IOM staff. They're being extremely helpful for setting today's workshop and making this happen. Welcome to the workshop.
My name is Ralph Weichselbaum, and as you can see, Tina's the health policy person who did 99% of the heavy lifting. I do want to thank Cheryl Nass and her staff that I've been to a number of these workshops. It's very labor intensive, and they do 99.9% of the work, including getting various people on conference calls, which is a seemingly impossible task. I would say as we go through this, you want to think about all these technologies in the context of, are they any good? That is, do they help? If they do, who do they help? How much does it cost? And where should they be located? I think those are the fundamental questions. I think, and I haven't read the bill, but there's a bill in front of Congress now that passed, I think, the Senate, and it's in the House. And there are some very loosened provisions for device funding. And I think unless we take some measured stance toward this, this could get out of control and come back to bite all of us in the context of oncology care. I'd like to thank the colleagues, the experts who are going to speak on this, especially the one I put the arm on myself, Steve Shimura and Ted Lawrence, who probably would rather be on vacation, as well as Tony Zeitman and Dr. Steinberg, who I just met, and Carol Hahn. And I don't mean to leave anybody out, but I'm appreciative of you coming, and I'm looking forward to this. Thank you.